everyone, how's it going? Today I'm going to walk you through a really interesting procedure here at the clinic. I'm working with a patient who's had an issue with their toenail since they were a baby, but this is the first time we're doing a full treatment using fiber. Here's what's going on. The nail lifted a while ago and they haven't been coming in for regular maintenance. What really complicated things is Roaccutane, a strong medication they're taking. This med makes the skin super thin, and for someone prone to ingrown nails like this patient, it's almost guaranteed to cause the skin to break open. I can see here that just a slight growth in the nail's length caused the skin to split. There's no spicule or anything like that in the nail, but I need to align the nail with the skin to help it heal properly. If I don't do this, within a week, a granuloma, a kind of inflamed tissue, could form in the area. I'm explaining all this so you understand why each step matters. The goal is to fix the issue without making it worse, promoting a natural and quick recovery. Let me tell you more about this patient. They've been on Roaccutane for about 4 or 5 months, maybe longer. Ever since they started, their nails began to get inflamed, even on their little finger, which is more noticeable now. When they first came to me, they had granulomas on 6 nails, almost all of them. After a month of treatment, the skin went back to normal, no more inflammation, but funny enough, a month later, it started up again. On this toe, both sides had granulomas. I didn't film it back then because they were in a lot of pain, but you can see how the nail grew out incorrectly. I'm shaping it round, not square, because a square cut makes it more likely to get inflamed in this condition. They're on a 27 milligram dose, and let me tell you, there was a granuloma that reached almost halfway up the toe. It's looking much better now, but we need consistent maintenance while they're on this medication. One of the side effects of Roaccutane is exactly this. The skin gets so thin that if you're prone to ingrown nails, it's going to flare up for sure. I'm showing you this so you can see the impact. If you're prone to this, it'll happen, but if you're not, count yourself lucky. To give you some context, Roaccutane is a medication that reduces acne and skin oiliness. It's commonly used by teenagers during puberty when they get a lot of pimples on their back, face, or chest. But it thins the skin so much and dries everything out, it's tough. Even lips can crack. That's why you've got to take extra care, use moisturizers, and follow your dermatologist's advice. While on this treatment, make sure to trim your nails straight across, avoiding a bad cut, or you'll end up with issues like this. I'm explaining this because it's key to preventing flare-ups and keeping your nails healthy. I care deeply about your well-being and my patients, you know? I get that ingrown nails hurt and can really hit your confidence, but with the right care, it's fixable. In Brazil, we place a huge value on nail care. It's a big part of our aesthetic culture and self-esteem. A lot of you in the comments ask why I don't just remove the whole nail, and here's why. In Brazil, we prioritize aesthetics and confidence. Not all professionals around the world think this way, but my focus is on solving the problem while restoring the nail to look beautiful, maybe even better than before. In this case, with the thin skin from Roaccutane, I'm using fiber and a wet dressing to speed up healing while keeping the nails' natural look. Hey, where are you all watching this video from? Let me know in the comments. Brazil, the US, anywhere in the world. And if you've taken Roaccutane and had nail issues, share your story. I read every single comment, and since there are so many, I reply bit by bit, connecting with each of you. I love reading and engaging with you all. Moving along with the procedure, I've noticed I tend to break some common podiatry rules. Most podiatrists use a dry dressing for granulomas, but I prefer a wet dressing, which keeps the area moist and speeds up healing. I've tried dry ones, and the healing just isn't as fast. The skin responds better with controlled moisture. This doesn't mean others are wrong, it's just my approach based on the results I see with my patients. I get a lot of questions about this, and for my procedures with the products I use, the wet dressing gives 100% satisfactory results. That's why I'm using it here to show you how this toe will look in a week. I'll share the follow-up as I always do. The healing is amazing, folks. Now, as I work, I'm staying super calm, focusing on every detail. Check this out. I'm applying the fiber now, a technique to correct the nail's curve and prevent it from becoming ingrown again. I'm placing it carefully, like a protective bag, around the affected area. This is crucial because their nail is a bit curved, and without this, even normal growth irritates the thin skin. I'm doing this to guide the nail to grow straight, reducing the chance of inflammation. You can see how sensitive the skin is because of Roaccutane. That's why I choose gentle methods to avoid stressing the area further. Here's an extra tip. After this procedure, I expect fast healing in a week. It'll look much better, as I always show. Care instructions: keep the wet dressing as I recommend. Avoid putting pressure on the area, wear loose shoes, and come back for maintenance to prevent reinflammation. This keeps your nails healthy and looking good. Love the content? Give it a thumbs up, subscribe to the channel so you don't miss more podiatry videos, and let me know what you think in the comments. Share this with friends who might need it, it could help someone out. Remember, taking care of your nails and feet is key to your health and confidence. With patience and the right steps, everything works out. Big hug and see you next time.